Hello, hi everyone. Happy Sunday. I'm here today again. I want to talk about best self-examination. Before I go further, please kindly follow, like, and share my page. I'm going to start with the topic of today. Best self-examination. What is best self-examination? It's just simple process by which a lady check his or her breast at home by examining, checking it by herself to be able to confirm or to check to notice any difference or any abnormality. So I'll be able to see his or her. We'll be able to see her physician or consultant. And actually, detecting doing breast examination does not diagnose that one has cancer of the breast. No, it's not. It's not a diagnosis. It cannot stand as a diagnosis alone. If you see your consultant will give you further check by further diagnostic test, such as mammogram, and to be able to confirm what you saw, you feel, and what he or she said feel when he checked you, and before we'll be able to say that okay, it's cancer or benign. But breast self-examination helps very well because it helps us to detect abnormality like lumps before it becomes cancerous. When the lump is detected, when it's still benign, it will be removed to prevent it from further damage, and it helps to detect any abnormality in the breast that can be very harmful to one's health. So that is the reason why and benefit why one needs to be doing young lady or a lady of puberty age should be doing regular breast examination monthly. And where is the best time for you to do breast self-examination? Best time for you to do breast self-examination is few days after after your menstruation, as in by that time the postmenstrual symptoms might have reduced, which are the postmenstrual symptoms are maybe tenderness, swollen, and pain towards or during the menses. So a few days after it, those things are subside. So you'll be able to get good results or good confirmation that this is what you know, this is what you feel, and whether it's normal or abnormal. So you'll be able to see your consultant. And the ways you can do breast self-examination, it can be done by lying when you are lying down on the bed. It can be done when sitting down facing the mirror. It can be done when you are standing. So there are 3 different positions you can do breast self-examination. So when you want to do lying down breast self-examination, want to check yourself at home, it's best done when it's either you want to go to bed, you want to sleep, or early in the morning when you wake up. It's best done then. And when you want to do it, you place pillow under your back to make it comfortable, it should make you lie down flat very well and comfortable, so you'll be able to get hold of every area of where you want to examine. And the standing and the sitting down position can be best done while you are bathing. You can do it while sitting down when you're not bathing too, but it's more better when you do it when you are bathing in the bedroom. That time your body is slippery, you will be able to get touch of everywhere and in front of mirror. And when you are doing it, how you do it, you use the tip of your finger, your five finger, the tip, you use it to start. Is either you start in from outward to inward or inward to outward. But before you start the breast self-examination, you first of all check for some things, like you check for the size, you check if there's change in color, maybe there's dimple. You check for the color, as I said. You check for the color, check for the size, and after you have checked for the size, you gradually use the 5 tip of your hands to start from your armpits, under your armpits. You check everywhere in a circular motion, go inward, outward, and when you get to the nipple, you squeeze it to be able to check for any discharge. If there's any discharge, you know that one. So when you check for the size of the breast, virtually don't be afraid when you see that maybe the breast is not equal, as in it's not of the same, the right and left is not of the same amount. It cannot be of size. It cannot be of the same size. You don't be afraid, because our body naturally, God didn't make it everything equal. Like our hands are not equal. So if it's like that, no problem. But what you should just check that there is no pain when you are doing it, there is no discharge, and there is no hard lump. There's no something hard, you didn't feel anything. You use your right hand to check your left breast, your left hand to check your right hand to check your left breast. You use your left hand to, so vice versa. That is how you do it. So when you do it like that, after you finish, if you notice anything abnormal, you should not be scared. You should not feel that it's cancer. Out of 8 to 10 people that confirm, or they confirm that they have lump in their breast, does not mean that the breast they have cancer of the breast. So most of them that are benign. What you just need, that you should just go and see your consultant and talk to your consultant. This is your findings, and let he or she to confirm what you notice. And when you need to notice anything like leakage, or maybe something like discharge from the breast, try to see your doctor. Or if you pain, a pain that is abnormal, you let your consultant know. As from the inequality of the breast, if you do it regularly, you will be able to know that this is how big the right is, this is how small the left is. So by the time you do it regularly, when you then see any changes from it, to be able to know that there's changes, and you'll be able to see your consultant. So, and again, it's not only women that should do breast self-examination, but it's rare in men. Some men too used to have lump, but it's rare, very rare cases. So even men too, at their own time, they can, just like those ones that are a little bit chubby and chubby, they should try and do it once in a while. So when you do all these things, try to see your consultant, discuss it with your consultant. If you notice anything abnormal, like you notice change in color, you notice change in size, you're supposed to know the size, how your breast is. If you know that the child has the size has increased more than the way it's supposed to, you should be able to talk to your consultant. If you notice there is dimple or color somewhere, you should be able to talk to your consultant. If there is discharge, you should be able to talk to your doctor, so that early intervention will be put in place, and further damage will be prevented. And for women that are above 40 years, once we clock 40 years, a regular mammogram is best advised for them to do. Some studies say that yearly a woman above 40 should be doing mammogram for proper care. So because if you do mammogram, you'll be able to tell the physician how healthy this tissue there is, and when there is deviation for normal, they will be able to take proper action and prevent any further damage. So at this point, I'm going to bring our talk to an end, and we should not forget, every lady should practice breast self-examination every month. It's something you can do at the comfort of your home. It's not expensive. Just see it as a routine, health routine for yourself, to take care of yourself, and to go a long way to help you, to go a long way to detect any abnormality, to go a long way to prevent any further harm. So at this point, I'm going to bring the talk to an end. Thank you very much. Please don't forget, kindly like and follow and share my page. God bless you all. Happy Sunday to you.